I mean, looking back the pictures just a year ago, I can definitely say that I'm the younger version of me that was a year ago.
We have done combination treatment of FUT and FUE. The advantage was we get thinner single hair grafts for front hairline by FUT and thicker double and triple hair grafts. You can see in between there are double and triple hair grafts which are by FUE. So by combining FUT and FUE, we get the natural looking hairline as well as a denser looking hairline. The hairline should be gradually modifying from low dense area to high dense area.
This is kind of a dream come true. I've come across a lot of my old friends recently, and all of them have simply said, either you've just gone back 10 years and did something, because you're not the same Jatin that we knew a couple of years ago. The hairline itself, it is so natural. I would just go ahead and say even many of the doctors will not even identify that I've gotten treatment done. I've come across this comment a lot many times from different people.
And ultimately the things which has to be discussed is the implantation part, which nobody discussed. What they discuss, what technique you want, strip or FUE?
FUE is the latest one, so you have to go.
You want older technique or newer technique? You want stitch technique or non-stitch technique? The person who is undergoing hair transplant should understand, you rightly said, it's a more of art. So you have to judge the artistic sense of the surgeon. You want ultimate good hairline design, a good density and no side effects on the back side.
Learning something is different, but knowing how to apply that is completely different. So you can learn how to draw a horse, but how to draw a horse in a proper manner, that's what makes a difference. And this is a major difference between Doctor Suneet Soni and the other surgeons. He actually understands the hairline that would suit the particular patient. If it's to be taken a little bit aback to make it look more natural, he would take that into consideration. If it needs to be brought forward, he'll take that into consideration. This is something that I particularly feel very good about, because I myself am an amateur artist, so I understand when he says that I'll make sure that the hairline is absolutely natural and no one would be able to make out. And if I would to say, not a lot of doctors also are able to make out that I got the treatment done. So that itself is a testimony in itself.
There are two different techniques of extraction. One is FUT, in which we harvest the strip. One is FUE, in which we singly harvest the hair. There is limitation of FUE as well as FUT both. In FUT, the advantage is we are harvesting in one go a bigger chunk, so we can harvest more number of grafts. For example, maybe around 3000 plus or 3500 plus. In FUT, we have another advantage that we cut under microscopic magnification with proper visualization of angle and direction of the hair inside the skin. That's why we can prevent the damage to the minimum level because it is under vision. In FUE, the limitation is because we are extracting hair with a gap, like we are extracting one, leaving one, extracting one, leaving one. So 1 in 4, 1 in 6 is the limit of extraction, and if we extract from the safe area only, around 2000-2500 grafts is the ideal recommendation of FUE extraction. If we try to extract more graft in FUE, like 3000 grafts, 3500 grafts, we have to closely extract the grafts so that the damage will be on the donor area, it will be depleted. Secondarily, there will be micro trauma around the grafts leading to further loss of the donor area or thinning of the donor area. That's why the second extraction of FUE will become very difficult or maybe impossible. So nowadays we have combined the approach of FUT and FUE. So in a combined approach, we take a strip, leave some area intact for the next strip harvest, and the remaining safe area we extract FUE in a limited quantity. So when we extract FUE, we always limit our extraction maybe up to 500 to 1000 grafts, and combined with FUET, so that we can get more grafts in one go. For example, by FUT, maybe around 3000 3500 grafts, another 1000 grafts by FUE. So making up to 4500 to maybe 5000 grafts. So 4000 to 5000 grafts are quite sufficient to cover the scalp, maybe front as well as the mid scalp, or sometimes the front as well as the vertex. Contrary, if we do only FUE or only FUT, what happens? Either we will be covering front or back, or going in multiple stages to cover the bigger areas. So combination of doing FUT and FUE has a definite advantage of getting more number of grafts in one go, as well as we have another chance to extract FUT in future. So FUT and FUE combination with PRP is now the gold standard technique to operate, and that we are following and getting the exceptional results with that.
I've searched probably 30 plus surgeons in Delhi NCR region. I've searched for surgeons in Delhi, in Gurgaon, even in Noida. From the researches that I did and from what Doctor Suneet Soni told me, this was a much more better option because for first, it would help me preserving much of the donor area. And then again, because of that, if in case I want to get the treatment done again in the future, probably let's say 10 to 15 years after, the donor area still could be utilized to do another session. The way he treated and the way he handled me as a patient, and also my parents, because my parents came along with me because this was such a delicate treatment. The way we were all treated in such a warm manner, I was definitely spellbounded. In terms of the surgery itself, he explained me each and every step of how things are going to happen, and if I were to say regarding the pain on a scale of 1 to 10, I would rather give it a -1. I mean, it might sound a bit boosting about him, but me as a patient, I'm really telling the truth when I say it was -1, because I did not feel pain at